Can you explain how heating promotes health and helps with injuries?
So the biggest way that I think heating helps with injuries is when you have kind of the chronic tight backs, tight muscles. You can use ultrasound, you can use a hot pack especially to just loosen up. It brings more blood flow to the area and just loosens it so you can stretch it further and things like that.
What type of modalities would you recommend?
That would depend on the injury, but as long as it is kind of out of that acute phase and it's been a few days, a few weeks, my biggest go-to is just a hot pack, again, because it heats it up, helps loosen it. So I usually have people start with that and then stretch them out if it's that kind of thing. And then for tendinitis issues especially, I will use ultrasound, and there's a portion of it that you can actually use to heat with. And so again, it just warms that tendon up so that it's not tight and irritating the person.
That's cool. What are the most common heating agents?
Well, just to be redundant, same thing. So again, the hot pack is probably the most commonly used, I would say. As well as I don't do it here, but at the collegiate level where they have multiple tubs, often before practices they'll make one kind of a hot tub style so that people can get that full lower leg, lower body warm up, and then ultrasound if you're using it to actually heat.
Okay. Do you have any common injuries that are usually used with heating agents?
If I'm doing ultrasound, then definitely kind of the tendinitis issues that aren't going away, but that they also don't want to or don't have the option of just taking time off and resting, then I'll use that to kind of warm up the patellar tendon especially, or elbow tendinitis issues, I'll use that. And then again, just chronically tight muscles that are not loosening up with just stretching, then throw some heat on when it gets colder. Towards the end of the fall sports, sometimes they'll heat up before they head out for the game so that we can get those muscles warmed up and try to avoid injuries.
Okay. Have you ever experienced anything that bad has happened with heating agents, like burning?
Yes, so especially with hot packs, the hydrocollator is ideally supposed to be at, I want to say 160 is like the hottest that it should get, so clearly very, very hot. And if you don't have enough layers, you can get blisters and significant burns with those, just like with the ultrasound. If you aren't using any gel or you don't have enough gel to be the conductor, that can lead to burns as well.
Okay. Thank you.
You're welcome.